In late June of 2022, the White House Office of National Drug Control Policy released its Telehealth and Substance Use Disorder Services in the Era of COVID-19 Review and Recommendations Guidance. While this publication doesn't have the force of law, it does give clear direction to legislators and agencies on advancements in telehealth for substance use disorder patients. So these recommendations provide some helpful background on the pandemic's impact on individuals living with SUD, also provide some background on telehealth, what it is, how it's delivered, and additional information on current state law and policies across the country and federal law and policies. First, there should be more federal support of mutual recognition and reciprocity of state licenses. Right now, there are several interstate compacts such as PsyPact for psychologists, the Interstate Medical Licensure Compact, and the Nurse Licensure Compact, just to name a few of them. The problem is that for these compacts to take effect, they need to be enacted by each state legislature, and that can take a lot of time and can present inconsistencies depending on the specific language that's used. So the first recommendation then from the White House is to encourage the federal government to encourage reciprocity among state licensing systems. The second recommendation is to permanently enact and expand the PHE telehealth regulatory changes. This recommendation calls to the DEA to consider making permanent changes, such as allowing qualifying practitioners to prescribe controlled substances to patients via telehealth without first needing to conduct an in-person evaluation. There's some significant changes that these recommendations are asking for. The third one is to increase funding for mobile app and assistive technology services, telehealth services. So this recommendation is a call to private companies and government organizations to fund projects that provide access to the internet. And there's already been some federal legislation passed in this direction, including the American Rescue Plan Act, which included a multi-billion-dollar appropriation to help expand high-speed internet access. But this recommendation is actually pushing for more than what's already happened. Then the fourth recommendation is to consider the privacy and ethical implications of telehealth use. Many of the platforms used to provide behavioral telehealth during the PHE haven't been fully HIPAA compliant, but they are easy to use and they're helpful. So this recommendation is suggesting working with tech companies to gain HIPAA compliance and asking policymakers and legislators and healthcare providers to weigh in on ethical considerations, such as issues of consent or accessibility, data use and protection to provide ethical and honest service to patients.